Well, I'm an 86-year-old lady. I've lived a long, very interesting life.
When Ms. Haracz first came to see me, she was very short of breath.
To deal with my shortness of breath, I just kind of slowed down. Activities were shortened or not considered.
She had this very leaky valve. Fortunately, she was a good candidate for a mitral valve repair with a MitraClip device. She was one of the very first to get the newest 4th generation device. Fast forward several years, she became symptomatic again. Turned out her mitral valve was fine, but now her sister valve, the tricuspid valve, became leaky. And through enrollment in a clinical trial that we were participating in, she was actually one of the very first people to be enrolled and to get a repair of her tricuspid valve.
For Deborah, we did a transcatheter edge-to-edge repair, also known as a TEER. After a year, she's feeling great and is able to do things that she wasn't previously able to.
It's been an awesome experience for me. I'm a happier, more content person. In spending time with my great-grandchildren, it's a little easier now. I feel a little bit stronger and more comfortable in just holding them and talking to them. It's generally made a much nicer, more pleasant life for me.
For each patient, countless hours and tons of paperwork go into getting them into the trial. So for Ms. Haracz, this alone is all of hers and just shows that we're persistent and keep going until we get them into a trial.
Deborah's story tells a lot about this Cardiovascular Institute, which is that we are not only a place for clinical care, but we're a place for innovation and research. This is what I consider an academic, non-university hospital setting. And that means that we have all the missions of the academic centers. We care a ton about our patient outcomes, and we do it in an environment that's very easy for us to both take care of the patients, but also still stay on the cutting edge, do clinical research.